Pardon us.
Oh, hello there.
I'm CJ,
And I'm Oliver.
and this is
Mapoy's
Mapoy's Essentials TV.
Today we're gonna talk about food. I mean the digestive system.
That's right. So, do you know how we get our energy to get through our daily lives?
Or do you know how food goes from here to you know where?
That's right. So let us tell you piece by piece.
Here's Roman and Desma for the first organ of digestion,
The map.
Do you like to eat or do you like to talk? If you like both, then let me tell you about the oral cavity.
First is the lips, formed mostly by the orbicularis oris attached to the masseter and the buccinator muscles. Then you could see the gums or the gingiva. And of course, there's the teeth. Contains the incisor, canine, premolar, and lastly, the molar. The same with the lower part of the and there is the palate, roof of the oral cavity. That's the tonsils, and the U shape is the uvula. Inferior to it is the frenulum, a thin fold of the tissue that is anterior part of the tongue. Those are the salivary glands, and the glands are composed three parts, which is the parotid, mandibular, and the sublingual. Lastly, this is the tongue, a large muscular organ that occupies most of the oral cavity. Thank you.
Thank you, Roma.
Now let's talk about the result of eating too much and too less.
Here's Leandro Legaspi report.
Most people, especially children, eat too much without considering the cleanliness of the food. That is why they develop this acute illness called tonsillitis.
The tonsils are two glandular masses of lymph node-like tissue located on either side of the throat. If a person's tonsils have not been removed, the tonsils can usually be seen by looking in the person's mouth at the back of the throat. The function of the tonsils is to trap incoming bacteria and viruses that might enter the body through the throat. The tonsils trap illness-causing organisms with infection-fighting cells and antibodies. However, sometimes the tonsils themselves become infected. When this occurs, a fever and sore throat may develop. The tonsils usually become red and swollen, and they often will have white spots on them. If a doctor determines that the infection is bacterial, medication may be prescribed. However, since tonsillitis can also be viral, do not allow children to take aspirin products because a serious disease called Reye syndrome could ensue.
And sometimes people tend to not eat at all. And the buildup of acid and water consumption usually leads to what we call heartburn.
Eating spicy foods, such as pizza, may cause a person to feel heartburn. Although the name may imply the heart, heartburn has nothing to do with the heart itself. Heartburn is pain felt in the chest by a burning sensation in the esophagus. Here, you can see the pizza passing from the mouth to the esophagus and onto the stomach. At the junction between the stomach and esophagus is the lower esophageal sphincter. This muscular sphincter acts as a valve that normally keeps food and stomach acid in the stomach and prevents the stomach's contents from regurgitating back into the esophagus. However, certain foods may affect the lower esophageal sphincter, making it less effective. That's how heartburn begins. The stomach produces hydrochloric acid to digest food. The stomach has a mucus lining that protects it from hydrochloric acid, but the esophagus does not. So, when food and stomach acid regurgitate back into the esophagus, a burning feeling is felt near the heart. This feeling is known as heartburn.
And this is Leandro Miguel Legaspi reporting live at JD Roadhouse Branch.
Food, more food for me, more food for me.
Stop!
What?
Don't you know that could cause indigestion?
Really?
Yes, actually. There's more of that from Bea Samarista.
Stress, angry, lonely, food. Some people whose emotions got high tend to eat a lot of food. One result of eating a lot of food is indigestion. Indigestion, also known as dyspepsia, is a vague feeling of discomfort in the upper belly or abdomen during or right after eating. This may include a feeling of heat, burning, or pain in the area between the navel and the lower part of the breastbone. A feeling of fullness that is bothersome and occurs soon after the meal begins or when it is over. Indigestion can be caused by a condition in the digestive tract, such as peptic ulcer disease or abnormalities in the pancreas or in the bile duct. Sometimes a person has indigestion for which a cause cannot be found. This type of indigestion, called functional dyspepsia, is thought to occur in the area where the stomach meets the intestines. Speaking of the stomach, it is located in the upper abdomen and plays a central role in the digesting food. When food is swallowed and passes down the esophagus, the muscles in the stomach mix the food and releases gastric juices that needs to break down and digest the food. The amount of acid in your stomach varies. It obviously increases when you have eaten. There is always acid present in the stomach, but usually in small amounts. The stomach itself is made of protein, and unless it is protected, it will be consumed by the acid of the stomach. This is Bea Samarista. Back to you, CJ.
Thank you, Bea.
We'll be back from a short break. Well,
Yes!
man, you want?
No thanks, man.
Why not?
I'm busy.
Okay then, more for me. What's wrong?
Ulcer attack, man.
Ah, ulcer attack. Try this, Oliver's oil. So,
Oh, I feel better now.
and now we're back to Mapo's Essentials TV.
So far, we have talked about the mouth, the esophagus, the stomach, and their corresponding diseases. And now,
We have one trivia for you guys.
okay, what's that?
Did you know that gluten from wheat can actually harm you?
Explain.
More on that from Chason's Ready.
Worldwide variation in the frequency of celiac disease and changes over time. Until recently, researchers thought that celiac disease was mainly a problem in Northern Europe, Australia, and uncommon in North America and the Middle East. However, with better data, researchers now regard celiac disease to be equally common in all these places. Their data showed significant differences between and within countries in the prevalence and incidence of celiac disease. Rates and overall numbers of both clinically and serologically diagnosed celiac disease increased in the recent years. Celiac disease is increasing in frequency, with significant geographical differences. It is possible that celiac disease may become more common in these countries in the future. That would be all. Back to you, Oliver.
Do you smoke?
No.
Do you drink?
Occasionally, yes.
Well, our health correspondent, Girlie Piminto, will tell you one of the bad effects of excessive alcohol intake. Girlie?
And another bad effect, acute pancreatitis, from Armel Pagunsa.
Armel?
Armel?
Good day, folks. Today, I will be talking about pancreas and acute pancreatitis. What is pancreas? Pancreas is an organ located behind the stomach that produces chemicals called enzymes. Most of the time, these enzymes are only active until they reach small intestine, where they are needed to digest the food. When the enzymes somehow become active inside the pancreas, they eat up and digest the tissues of the pancreas. This causes swelling, bleeding, or hemorrhage, and damage the pancreas and its blood vessels. Acute pancreatitis affects men more often than women. This condition is most often caused by alcoholism and alcohol abuse. The symptoms of pancreatitis are abdominal pain. The pain may be worse the minute after eating or drinking, especially if the foods has high fat content. People with acute pancreatitis often look ill and have fever, vomiting, even swelling. This is Armel Pagunsa, live from Plazuela de Iloilo. Back to you all.
And we're going to be back after a few words from our sponsors.
Thank you. And now we're back from the break.
So far, we have talked about the mouth, the esophagus, the stomach, the liver, the pancreas, and the small intestine. Next, we're going to talk about the large intestine and the famed appendicitis. More from Stevenson Santiago. Steve?
Thank you, CJ and Oliver. I'm here to discuss about the large intestine.
The large intestine is the last part of the digestive system in vertebrate animals. Its function is to absorb water from the remaining indigestible food matter and then to pass useless waste materials from the body. The large intestine consists of the cecum, appendix, colon, rectum, and anal canal. It starts in the right iliac region of the pelvis, just at or below the right waist, where it is joined to the bottom end of the small intestine. From here, it continues up to the abdomen, then across the width of the abdominal cavity, and then turns down, continuing to its endpoint at the anus.
And for our last,
And we mean the last,
portion of today's program, we have the digestive process
with
Ran
Ran Mapoy and Jill Lim.
Lim.
Take it away, guys.
Thank you, Oliver and CJ. If there's one thing Filipino won't say no to, it's food.
But do you know how food is digested?
We're here to explain the process of digestion.
Digestion is a process of changing food into a form that the body can absorb and use as energy or as the raw materials to repair and build new tissue.
The teeth chew, breaking the food into small manageable pieces. The salivary glands release a watery liquid or saliva to compact the food into a mushy bundle that can slide easily down your throats on a stream of saliva. Enzymes in the saliva begin to digest carbohydrates in the food. The tongue lifts to push the whole ball of wax back toward the pharynx, the opening from your mouth to your esophagus, and then through a muscular valve called the upper esophageal sphincter, which opens to allow the food through. In other words, you're about to swallow, entering the esophagus.
As food enters the esophagus, your salivary glands release a rush of saliva to help food slide more easily down the tube. Then your esophageal muscles swing into action. Like the rest of our digestive tract, your esophagus is ringed with muscles that contract to produce wave-like motions, which you can refer to as peristalsis, pushing food towards your stomach.
The stomach contracts with enough force to break food into ever smaller pieces as glands in the stomach walls release stomach juices. The stomach juices begin the digestion of proteins and fats into their respective bodily building blocks, which is amino acids and fatty acids. Churned by the stomach walls and degraded by the stomach juices, what started as food is now a thick, soupy mass called chyme. The stomach's wave-like contractions push this messy, but still intact substance along the small intestine, where your body begins to pull out the nutrients it needs.
Large intestine absorb water from the mass you deliver to it, and then squeeze the dry leftovers into compact bundles of waste, which you may know as feces. After resident colonies of friendly bacteria digest any amino acid remaining in the waste and excrete smelly nitrogen in a process that is called passing gas, the muscular contractions in the rectum push the feces out of your body, and digestion is finally done.
And that's how the digestive system works. Did you learn something?
I'm sure you did.
Once again, this is CJ.
And this is Oliver for
Mambo's
Mambo's Essentials
TV.
TV, episode 4932, the Digestive System. Paano pagkaon? Alam mo, CJ lang, ulo.